So as you've said, plasma therapy is not a new form of therapy. It's been there for more than 100 years. Used first time in the 1918 pandemic and has been used in number of diseases including polio, more recently in the MERS coronavirus. And there are two small studies of around 6 and 10 patients where it has been shown that it may be useful. There are 2 or 3 things which is important to remember. One is plasma therapy is not the only treatment strategy, and it's not that it will be effective in all patients, because there are a number of other things which are happening in people who are infected with COVID-19. They have what we call acute respiratory distress syndrome. There is a lot of infarction occurring in the lung. They also have what we call a cytokine storm. A lot of inflammatory markers come into the blood, which are not going to be treated by just plasma therapy. So it's a holistic treatment which needs to be done. Second important issue to understand is that plasma therapy is having people who have recovered, and after their recovery, 14 days after they're negative, willing to give their blood from which the plasma is taken. Also, the blood that they give has to have good amount of antibodies. So there are certain studies which are coming from India which suggest a number of people who are recovering are not having that good amount of antibodies based on the antibody testing kit. So we have to be careful about what treatment we're giving, because that has to have good amount of antibodies. And then giving it to sick patients. So getting plasma from donors, testing it to see it as adequate antibodies, then being able to keep it and give it to people who have COVID-19 and are very sick has to also be worked out. And then there are ethical issues about people willing to donate their blood and how it can be used. So I think it is one form of treatment, but we should not look at it as a magic bullet, because there are a lot of other things that are required that have to be given holistically. And the data for using it as far as COVID-19 is concerned is related to two very small studies where some benefit was shown. So we need to look at it in a more research type of a treatment modality rather than actually something which can be done for all patients suffering with COVID-19. So plasma, all treatment have some risk involved. The blood has to be properly screened. There can be other transfusion related reactions which can occur, including the fluid overload and other things which are well documented for any blood transfusion that is done. And that is something that we need to keep in mind as it is for any treatment. But otherwise, having said this, in terms of treatment, it is a relatively safe form of treatment. So plasma therapy is currently a treatment. It is not given to prevent COVID-19. It's not like a vaccine. It's basically antibodies, so they give passive immunity to someone who is already having active disease, and that is how we're looking at it. So what I'm trying to say is we will have to select patients properly. Just taking plasma from everyone who has recovered and giving it to a sick patient may not be enough. We will have to do a detailed antibody titer testing to see what is the degree of antibodies in the plasma, and then be able to say that yes, this person who has donated blood has good antibodies and it could be given. So I still feel that it needs to have rigorous research which is being done in many hospitals in India, including our hospital, before we are able to say that this is a good and effective treatment. So COVID, there is a lot of feeling that if we have very high temperature, we may be able to have a decrease in the number of cases of COVID-19. It is true that the virus dies more quickly in temperatures which are that high, but we must remember 2 things. One is that the infection is also happening in other tropical countries, Singapore and Brazil, where the temperature is tropical and again more than 30 degrees centigrade. The other thing to remember is that although we may have decrease in the virus survival in the outdoor environment, a lot of us are indoor, where because of air conditioning and other things, the temperature is much lower. And if someone has infection there, is coughing or is touching surfaces, the virus will survive in the indoor environment for a longer period, and there the infection can still be transmitted. It could be your office, it could be shopping malls, it could be other indoor areas. So the temperature alone will not be able to make that much of a difference. We have to have social distancing, hand washing to be done as we are doing right now to prevent the spread of the infection. So although the cases have increased 21,000, the number of cases per day has not spiked that much. We have seen over the last 1 month that the cases have been steadily increasing. There's no sharp spike, and that has not caused a huge strain on the healthcare facilities. We don't have a very large number of patients who are in ICU, and our ICU still can handle the load which is coming. Having said that, we need to be vigilant and be prepared for what happens in the subsequent days, and that's why this time has given us. We have been able to prepare more in terms of facilities, COVID hospitals, centers which can look after patients if there's a surge in the number of cases. But I feel that even subsequently for many months, we will have to have a lot of discipline as far as citizens of a country are concerned for social distancing, hand washing, and behaving responsibly. If we do that, we will be able to keep the cases low. We will be able to make sure that we don't have a surge of cases as has happened in the developing world, and we will be able to overcome the pandemic that is really having a huge effect in many countries. So AIMS is having regular meetings every day for more than now a month, maybe 2 months. Planning has been going on. We have converted our NCI Jhajjar into quarantine facility. Our trauma center has totally been converted into a COVID hospital, and trauma has been moved to the main hospital. A building which would have taken 6 months to get ready, the burns and plastic surgery center, has been converted into a screening area where COVID suspects can be kept before, after which they are then shifted either to the COVID positive or to the main hospital as COVID negative. And a lot of planning is going on to see how we can also start services for non-COVID patients in this lockdown era. So teleconsultation and various other procedures have also are being looked at so that we can start operationalizing things. A lot of activity has been going on. We have already working on starting plasma therapy. We are lucky that a lot of our patients who have recovered have come forward and they have donated blood. So plasma is ready, and we are planning now to start it as a research tool in patients who are admitted in our ICU and are very sick with COVID-19. Currently, there is no data that plasma should be given to healthcare workers as an immunity booster. That data is not there, and that is not something that is being looked at also globally also, and even in our hospital.